Hi everyone, so today we're going to be looking at the cognitive approach to treating depression. Make sure you've looked already at the video on explaining depression because that was going to help you with today's lesson. So we're going to look at describing how irrational thoughts are challenged using CBT. So irrational thoughts are anything where they are kind of negative and probably incorrect thoughts, I guess, in terms of not factually correct. And then we're going to have a look at applying that knowledge of CBT and looking at the strengths and weaknesses of it. So CBT is cognitive behavioural therapy, and it helps patients generally to identify irrational thoughts and then also challenge and change them, because the basis of it is that people with depression have faulty or incorrect thoughts, and if we can just change those thoughts to more positive thoughts, then we're likely to help people recover from depression. And so there are two parts to this. So although we've looked at a cognitive explanation, this is taking a cognitive and a behavioural explanation, because we're looking at the cognitive, so identifying and challenging irrational thoughts, so faulty thoughts that are in our head, and obviously that's a cognitive approach. But we're also looking at changing, therefore, our behaviours and providing coping strategies to help with that. And so that is the behavioural part of it, the actions that we do. So the key elements are is that we identify irrational thoughts. So patients might be asked to think of an irrational thought that they know that they have. For example, it might be an irrational thought that everyone in the world hates them, and then they're asked to challenge that. So often the teacher provides, or the therapist provides, a kind of devil's advocate. So they say, prove to me that everyone in the world hates you. And the answer is that actually, does Barack Obama hate you? No, he doesn't know you, so he can't hate you. And that kind of challenging provides evidence that their thought is incorrect and their thought is still faulty. And a lot of the time, it might be that actually the patient doesn't know what their irrational thoughts are. So often the therapist has to talk through with them about what they're thinking and what they're feeling in order to identify those irrational thoughts. And those irrational thoughts we know can be split into three kind of blocks, which are the irrational thoughts about themselves, about the future, and about the world. And so therefore, the more rational those thoughts can become, the better you feel, and therefore you're more likely to overcome depression. And the final thing is about behavioural activation, and this is just about getting the patient to focus on positive and engaging activities that they enjoy, because one problem with depression is that people reduce the amount of time that they spend doing the activities that they used to enjoy, and they feel like they don't enjoy them anymore, whereas really they've just avoided doing those activities. So they also encourage patients to take up activities that they used to do. For example, if you used to dance and you've stopped that, taking up dance again because it's something that they enjoy, and helping them to overcome any problems that might be associated with that, like, oh, I can't dance anymore, I've got no rhythm. Getting them to believe that actually, you know, you did this a few years ago, you probably are very capable of doing it still, so you should give it a go. Now, rational emotive behavioural therapy is a type of CBT. So CBT is like the overall term for when we identify and challenge irrational thoughts. But there are lots of different kind of programs that people use in for cognitive behavioural therapy. So there are different programs that you could be put onto. And REBT, or REBT, is rational emotive behavioural therapy. And again, it works by identifying and challenging irrational thoughts, but they also look at disputing the irrational thoughts, so really challenging them. So they might ask them, for example, does it make sense that if a friend doesn't text you back straight away, they hate you? Is that really true? And they really encourage them to think rationally about their irrational thoughts, getting them to actually think about where do those thoughts come from and are they really true? And that leads to an effect, and the effect is that patients hopefully will change their irrational thoughts to more rational ones. They're also asked to do homework, and this is between the therapy sessions. They're asked to do things that they wouldn't normally do, like go to the dance class that they wouldn't normally do, or remember, for example, that, oh, my friend hasn't texted me back, this is what it could mean: that they're busy, that they're having a really tough time at the moment, they just need some space, that they are, I don't know, with some friends, they're sleeping. So getting them to do that throughout, and by writing it down, it gets them to think about it, because one of the real problems is that it's very hard at first to train your rational thoughts into rational ones. So by writing it down, it gets them to actually do it almost out loud, like they're practicing it. And hopefully the point is that at some point you won't need the homework anymore, because so it's a kind of subconscious thing, you do it automatically. So CBT, you might want to think about if there's evidence to suggest that CBT is effective. We know, for example, that it's used all across the UK. The NHS, the main treatment for depression is either antidepressants or a therapy which is CBT. So there is a lot of evidence to suggest that this is effective. But we know also, one thing to think about in terms of social sensitivity is that this is the main therapy that's offered, and maybe there might be better therapies for people out there. Also, what aspects of the person's life does it ignore, and what types of people might the therapy not be appropriate for? So there's lots of evidence to suggest it. For example, there's one that shows that 80% of depressed patients that were treated with CBT did show significant improvements. However, in some cases, depression can be so severe that this is not the point at which they need someone to challenge their irrational thoughts. What they need right now is just to feel a bit better. And so often what happens is, in severe cases of depression, antidepressants are given first, and then when patients feel in a better place, they accept CBT. So CBT isn't always the first port of call. It's also been overemphasised for its role on cognition. So it suggests that clients have irrational thoughts and that's what they need to change it. But actually, although it gives people the power to feel like they can change, it might not be the only cause of depression. It might be, for example, that factors outside of their control, such as a parent dying or losing your house, has caused this depression, and that's the thing that they can't change. So actually it's not very helpful in some ways to be like, oh, it's just your thoughts. Actually, it could be things that are going on around them as well. And finally, it suggested that the difference between therapies might actually be quite small. So there are lots of different therapies, and we know that if you think of a standard kind of therapy that you would have in like if you imagine like a stereotypical therapy where you like lie on a couch and talk about your feelings, that is a kind of psychodynamic psychotherapy. That's really expensive. It can cost like £1,000 a time to go to this therapy. But actually the difference between the therapies in terms of their recovery rates are quite small. And therefore it might actually just be that the quality of the person who's treating you is, and how they and their kind of relationship with you is the thing that causes the change, because you feel like you're valued by someone. If you go to therapy and someone listens to you and they care about you, then that makes you feel more valued in the world. So maybe it's just that rather than the actual therapy. Hopefully that was helpful for you.